I mean, I feel like opiate use or illegal opiate use has been a problem for a while. I think probably in the past 5 years, it's really just come to light because of such the high rate of overdose deaths or overdoses occurring in the county and in the state and even the nation. I know in 2016, Summit County saw a huge increase in the number of fatal overdoses. You might not be directly affected by this from a direct family member, but you're indirectly affected by this. This could be somebody in your child's school, somebody at your work. Everywhere you go, somebody is affected by this epidemic.
So let's talk about how people become addicted to this. There's a couple pathways. It used to be the pathway to addiction was through illicit drug use. People will go down, maybe smoke marijuana, maybe try heavier, stronger drugs. You would see that in addiction. The pathway to this is not. The pathway is a legitimate illness. Go to their doctor, go to their prescriber who gives them medication. In Ohio, we had a large number of pain clinics that were unregulated that started. People, when they weren't able to get their medication through their legitimate prescribers, were oftentimes referred to pain clinics that were giving them large doses and large amounts. Some of the really high-powered things like Oxycontin were actually created to help cancer patients. The fact that people were getting them for a minor headache was really a misuse of it and a misrepresentation of it. When the pain clinics became regulated, the heroin moved into Ohio, and people turned to heroin because it was cheaper and more accessible. Now what we see on the street is fentanyl and the fentanyl analogs like carfentanil and different derivatives of fentanyl, which can be anywhere up to 1,000 times more powerful than heroin. We know that the higher the high, the greater the risk of death. It's highly lethal, it's highly addicting. It takes very little for people to take it and become addicted to it. Challenge is we don't know who becomes addicted. We don't know why you always become addicted. Why can you take a pain medication and at the end of your prescription, you're done with it. You might feel a little uncomfortable if they didn't wean you off or taper you off. And your sibling, your friend, whoever, then becomes addicted to it and has that compulsive drug-seeking, intense cravings, and an inability to not take it without having severe withdrawals. We can't predict who that is.
Project DAWN stands for Deaths Avoided with Naloxone. It's a community education and naloxone distribution program. Project DAWN is important because it allows people that are in active addiction to stay alive. It's usually loved ones of people that are in active addiction will come to get a kit because it's hard to administer Narcan on yourself and nearly impossible. So people will come in to get a kit for somebody else as well as receive the education and training. Summit Safe is our syringe exchange program, and this allows participants to come to the health department and have access to clean needles as well as disposing of used ones properly. In our Summit Safe program, we have people come back weekly all the time telling us how nice it is that they're able to talk freely about their addiction without fear of being judged. Since our program is in our counseling department, we have counselors here that are able to talk and know how to connect with the participants. Just this past week, we had an individual come in to our Project Dawn training, and after some talking, she told me that she overdosed about 6 months to a year ago, and a stranger was just driving down the road and saw her in her vehicle. She was able to have Narcan administered to her, and the person said that they got their Narcan from this Project Dawn. She said without this program, she wouldn't be here today, and she was coming to get a Narcan kit so she could kind of return that favor. A great tip is come in, get a kit, and save a life. It's better to have it and not need it rather than need it and not have it. Get help if you're struggling. If you're a family member of someone that is in active addiction, there are services out there for you. Reach out, seek help.